login कर लिया है ना। We have to remove the. Hello? Yeah, you're able to see, right? Okay, I'll indicate when. I'll indicate when.
So they won't be able to see what I do unless you straighten it. Let's see how it goes. Just straighten it first. Adjustment can only be done. Forget about being there to be able to see the. Focus नीचे. I can show that, but then I'll disappear.
I think we should use this.
वही था ना पिछली बार। वर्चुअल स्क्रीन नहीं आएगी, दैट्स ओके।
वर्चुअल स्क्रीन इसमें भी ऑफ करना पड़ेगा क्योंकि जब नीचे कर रहा है ना तो प्रॉब्लम होगी क्योंकि यहाँ पे तो दे हैव व्यू टू
जरा करो, खुला नहीं छोड़ना तो कुछ जाने पे उसको तो छोड़, that is at a lower level, that won't show.
Okay.
That has to show. How will they see? How did they see last time? I think you were using something new. You can't see.
I was using the iPad.
I told you that time. You said no. I was saying plan it yesterday. No, don't mess it up. Let's see if this can come further forward. Or how did this see?
Can I use this as an iPad? I can rotate this.
How? Let this go.
हाँ क्या रख दिए प्लेट, खाना दे दो।
यहाँ से भी अनम्यूट कर दिया, यहाँ से म्यूट कर दो तो वहीं से रहेगा।
Hello.
Hello.
Am I audible? Please indicate in the chat box.
Good morning, sir. You're perfectly audible.
Thank you so much. Now, there was some goof up. I didn't know how well to show it. With Zoom, we had an issue because we've been using GoToMeeting regularly. So, am I visible?
Yes, sir. You're visible.
Hello? Am I visible?
Yes, sir. You're perfectly visible.
Am I visible?
Yes, sir, you're visible.
All right. So, let me know when we start, please.
Sure, sir. Can you hear me?
Yeah, what you can do is when sir is speaking, you can make where sir is sitting. Yeah, where sir is sitting, you can make that visible on the screen. Like right now on the screen, you can see the instruments, right? So in the main screen, you can show sir, and when he's demonstrating something on the table, then you can make this table will be shown, then this particular will come as the spotlight.
Hello everyone, good morning and welcome to the session today, the online surgical workshop. We are more than delighted to welcome you all to the session today. And I am Krishnan, the moderator for the session today, and I'll be helping out Sir. So a brief introduction before we give it over to Sir. Professor Chintamani is the President and Governor, American College of Surgeons at VMMC. Professor Chintamani is one of the finest and most renowned oncosurgeons and an exemplary teacher who envisioned the unique online suture practicum and surgical skills workshop during this unprecedented and challenging times of COVID-19. He has pioneered many surgical skills courses across the globe, and this workshop is focused on teaching medical students one correct way of performing basic and necessary skills. It includes introduction to surgical instruments, knotting, suturing, making an incision, etc. The online course was first conducted by the Gurukkul of Surgical Disciplines under his direct supervision and was a huge success. Learning the skills early in the career has a huge advantage, and it certainly adds to a medical student's professional growth. We at AMSA India would like to extend a hearty thank you as well as a welcome to Sir for accepting our invitation and giving us an opportunity to host this workshop. Thank you, Sir. Welcome, everyone. I'd like to give it over to Sir now.
Thank you so much for the kind introduction. I'm so glad to associate with you all. Teaching and sharing the information is always a true joy. First of all, please indicate in the chat box if you can hear me clearly, all delegates, because you've been probably muted, so you can respond in the chat box if you can hear me. You can, that's great. Can you see me? Wonderful. So that kind of kick starts. And I'm sorry about the delay that happened. We were very fussy about the time, but it so happened that we are not able to show you well, although we were already tuned in. But the trouble was that we had to use an iPad and maybe a couple of gadgets to make it visible to you. So what I'll do is, first of all, I would want my the instruments and the gloves that and the theater etiquettes that I probably do every time. I'll be doing first, and then I'll also ask you in between if you're able to watch me. And remember, it's not going to be one of those boring monologues. You'll be doing all these skills yourself. And as Sukriti had announced, she's my dearest postgraduate and now a registrar. She had announced that those people who are doing the skills, if they could take a picture of, please make it a point that on your video you don't disturb. There are lots of activities happening. Otherwise, I request the organizers to please guide them into not sitting in groups and making it look like it's a free for all. I mean, I can see a lot of videos. One way of doing it is to kindly take the videos away from the screen, because I can see them all going around in circles trying to do something. So let's make it a sincere effort to learn, and all your skills would be recorded, and we are not here for wasting time. So please, and don't just try to do it together, 4 people doing it together. We're already in a era of social distancing. And I'll be very shocked to see people sitting close to each other without mask on. So it's much better that you at least demonstrate that, and don't try to make it look like a casual affair. Well, a very good morning to all of you, and we'll start with the basic surgical skill course straight away. This is called Suture Practicum, and it's been brought to you with EMSA, and Gurukkul of Surgical Disciplines is, of course, very happy to associate with any such activity and the academic endeavors. Now, I'm looking at the screen. I hope you're able to see as I go along the skills that we do. And remember, when you are into the theater, you are taught as to how do you take care of yourself so that you don't cause any damage to anybody else, you don't cause any risk to others. So there are theater etiquettes. Now, the first one being the universal precautions. We know universal precautions are universal. We are in a COVID era, so we should learn about universal precautions anyway. And the definition of a universal precaution is precautions that you undertake, assuming that every patient with a potential HIV or hepatitis or nowadays corona case unless proven otherwise. So what do you do for that? You take those precautions by keeping your, there are various precautions that you take, but the important one is that you should bear it in the mind. I am very sorry, I'm able to see the videos where a lot of activity happening. Please switch off your webcam. We don't want to see anything. Please, can you switch off their webcams because it is distracting me. There are people sitting and yelling away to glory. Please switch off the webcams because they're all visible.
Sure, I'd request.
Please.
Good morning. So we request everybody to please switch off their videos and also to switch off their microphones where Dr. Chintamani is talking. Please switch off your videos.
Please switch off your videos. I think it's Mridul, Vaibhav. Don't try to create a ruckus. Don't get people around you. Just do yourself and focus on what is being taught. Otherwise, it doesn't go the way we want it to go. And we have a long way to go. We have to finish all the skills today. And please make sure that there is no confusion. Now focus on what is being discussed. So universal precautions, what I was talking about. These are precautions that you undertake or take assuming that every patient is a potential HIV case unless proven otherwise, or hepatitis or corona, as I said. For that, what do you do? Your answer usually comes out as we will put on a headgear, we'll put on a visor, we will try to put on double gloves, we try to have the what do you call the gum boots, etc. All that is all right, but importantly in the mind, you should believe that you should treat yourself as one potential candidate who might infect others, or you're one person who might be infected by others. So what do you do for that? You make sure that no two hands should exchange sharps. When we have to pass on these sharps, we should pass them on in a kidney tray. You won't have it today with you, but I'm demonstrating all of these because this is a part of the skills. And you also don't touch any body fluid with bare hands, and then you don't let anything splash into your face, into your eyes, so that you don't catch that infection. And at the same time, you keep the social distance now, which is mandatory. So I was getting distracted by a couple of videos where friends were sitting together and trying to do it like an exercise that they could do together. Please don't do that. It's likely to cause problems, and the whole teaching is a waste then if you don't learn it in practice. Okay? So once we are down to doing something in the operation theater, what do we do next? We clean ourselves up. People call it preparing and draping. People call it washing for the case. There are various names for it. Now remember, if you don't follow universal precautions, you're not going to work all the time in one institution. You'll move to other places and people watch you for how you've been trained in MBBS before they give you any internship or any training later on, here as well as abroad. And I'm talking about both USA, UK, anywhere. They observe you for your theater etiquettes, and in general, how do you behave like in the clinics. And based on that, they treat you. And it's important, therefore, to learn one correct way of doing it, which is what our principle is today. We are trying to do that today. So what do? You wash yourself in such a manner that your cleanest parts are the hands. And I'm not going to repeat, there are so many videos that are circulating for washing your hands in corona. Remember, there is an interdigital space which is very contaminated. Thumbs are the places which get contaminated. And also there are areas which are lying in between. So when you're cleaning up, this is a part which is going to be used for surgery. It should be the cleanest. Next, then next, then next. This would come off when we go for surgery. We have nothing here. This would go right up to the mid-arm. Why? Because you need to clear off right up to the mid-arm. And once you've cleaned up your hands with usually the antiseptic solutions, and now we have shields available, where you don't need to scrub the hell out of your skin. You don't have to use brushes anymore. You can just do by using shields, which have a lasting antibacterial activity. Now, we do that from the hands down to the mid-arm. That's why most of us have these loose arms in our drapes. All right. This is a drape of the Mount Sinai hospital in Canada, Toronto, with a skills center where the skills, I happen to be there for a while. So this down, everything should be clean. But once you've cleaned it, naturally, which is the most important part here. So which should remain up? This part. So we go like this. We don't start scratching our ears now, and we don't scratch somebody else's ear now. We are up there and we go straight up. Allow it to dry, and then we are mops to dry, throw, dry, throw. An important aspect of cleaning up your hand. What do? You clean it for at least 5 to 6 minutes, which is even longer that people advise you. And then clean your thumb like this, both sides, in between. So that then the back side, and you are done. Don't come back from here, go from here to the, that's a principle even when you're draping a skin. Go from the part which is most important to the part which is least important, and don't come back. I call it the centrifugal cleaning. So start from the most important area, which is the core area, and keep going outwards. I believe you've done that, and universal precautions I've taught you. So don't believe universal precautions are just wearing gumboots. Now, what you do to ensure that is, all right, you put on a headgear, you put on a visor, nowadays very popular. You have, of course, a mask on. Now you have an N95 mask. You have a plastic apron in front of yourself, and then you have the gown. And once you've gowned yourself, all of you, please switch off your webcams. We don't want to see you right now. Just do your skills. Later on, we'll see you. And don't try to show yourself off also. Just switch off your webcam. You don't give any excuse in the chat box. Please switch it off. Now, and therefore, what do? Once you've done that, we get into the gown. Also the inside out way, which I can't show you unfortunately here. But I have a suggestion that all of you watch our Gurukkul videos on all these exercises which have been recorded in the theater environment. So you can actually replicate that. I just want to introduce. The next is you've done everything. Now we go to the gloving, and that's where I want you to concentrate. Well, that's a glove you must have seen. It's a sterile. You take it according to the size that you fancy. And remember, we wear double gloves. We wear gumboots. Double gloves, they found that needle stick injuries occur much lesser. I won't come into the percentage. It can reduce drastically if you wear double gloves. And remember, needle stick injuries don't happen only to your enemies. They happen to your friends also. So, and to you also. So be careful not to use sharps in your hand. And in today's exercise, when you're doing all the suturing, don't hold the needle in your hand, which is a bad habit. And you generally pick it up during this training phase. And later on, it becomes a liability. Let me show you. So we've reached to the level of gloving. That's the first exercise. What do? All of you will wear it once I tell you, and then you'll move on with it. You can just open it, very easy, and don't throw it. It's a bad habit. You just peel it off and throw it. Like any wrapper, don't do that. It should go all intact. And you already clean, so you take the glove out, and this goes into the disposal box, which we will have designated for this purpose. And now we have the wrapper in which you have the gloves. I hope it is visible, otherwise we'll have to make it visible. Now, if you come from behind, maybe it will show. Now you can see, I hope it is visible, and please indicate to me that whether you can see the, yes, you are able to see it. That's great. I thoroughly enjoyed. It will show better if we come from the, yes, because it should show clearly. We'll take just a second, please bear with us, and we will show you. Okay, so we opened it up. Are you able to see it? I can see it in one screen, the other screen I'm not able to see it. Can you blow it up, please? Yes, that's great. I think that's wonderful. So you can see that the wrapper can be opened up, and don't disturb this combination, and this position should lie like this. There are two methods which are followed world over. One is the closed method and an open method. What you're learning today is the open method. An open method is important because this is what is practiced most commonly. Closed method is where there's a nurse that is gloved already, And then she keeps the gloves ready and you just slide into it. Things that you must have seen in some English movies, or if you've seen the serial MASH, which used to come for the Korean War. It's an American serial on surgeons. Well, so what you see here is a glove, and I can see this gentleman in red shirt trying to hold on to the phone. Yeah. So this is the left side. This is the right side. Usually it is written so you won't get confused. Otherwise, you can see the thumb. And if I'm a right-handed surgeon, what would I do? Remember, I can touch it, so I'm showing you. This is the inner side of the glove. That's the outer side. Don't ever touch the outer side with bare hands. With a gloved hand, you can. Now, what do? I'll hold on to the inner lining. I'll hold it in my right hand. And what do I want to do? I want to get the left hand in. And it's clearly visible on the screen. And now I don't hold anything else. I just, look, I'm holding on to the inner side only, and I'll leave it there. Now I'm gloved. So what can I do? I'll again hold. This is the right side. I've held it in my right hand, and I am matching it with my thumb, but I can go on to the outer side now because I got a glove on. So it's not, my hands are not bare. Now what do? I'll just pull the ring as high as I can, which will usually be covering my gown, which I don't wear now. Now I have a ring to hold here, and I am gloved. Now I'm giving you a minute to glove yourself, please. Or maybe I'll demonstrate and then you can do it so that we avoid confusion. I'm gloved. So I'm ready to go. And what do I do with this pack is important. Learn this. I'm holding on to the inner side, or I'll leave it for the nurse to throw it. It is gone. Done. Now we move on to the first exercise of the day, the second exercise of the day. I'm sorry. We all recognize surgeons with a scalpel. Don't call it knife, although casually we may. Knife is used by criminals. Scalpels are used by surgeons. You're going to be bright surgeons. Now remember, this is called a Bart-Parker handle. This is the Bart-Parker handle. And remember, before this, Bart-Parker company brought out this for a detachable blade. You see, earlier it used to be a fixed assembly. Of course, this is a disposable one, but the assembly is fixed. There used to be metallic fixed assembly scalpels earlier. Now, what was the disadvantage of that? If you keep autoclaving regularly, it will blunt the sharp. It'll blunt the sharp part of the blade. So it was not very popular. So what was decided? Let's have disposable ones. So to have a disposable blade is expensive. Disposable scalpel is expensive. So they came out with a system whereby they can have the handle, which is permanent, but they can have a the blade on it, which is disposable. So that would be already autoclaved. So that would save the autoclaving problem. Basically, they were always, the concern was that autoclaving can make it blunt. So the important thing to learn in a Bart-Parker handle is it has serrations. If you could zoom, please. The serrations here, whichever instrument has serrations, remember that those serrations are for the grip. So folding it anywhere else is a modification of the classical way. Remember, whichever instrument has serrations, that's where we hold it. There are various grips to it. And what I'm showing you right now is a palm grip. There are two main grips, palm and paintbrush grip. This is a palm grip where it disappears in the palm. I'm holding between the middle finger and the thumb, and it disappears in my palm. And what do? I use my index finger to guide my incision. And remember, incision is made It is not given. Is it right? Right, so I think better. I've shifted it so that it will be visible. Now, so I showed you the Bart Parker handle. Now I'll show you the next exercise, how to lay the blade onto the handle. A lot of you must already be knowing it, but remember, learn. The promise is to take care of even those second years or first years who are joining it. And I especially welcome them for this course because they are the future, and so are you all, the future of the doctors that are going to change things as they practice. Please learn one correct way of doing it. And I still remember those 15 scholars that we had chosen by in our conference last time, which was an American College of Surgeons conference. They're all now undergraduate members of the American College of Surgeons, which is quite a prestigious thing to achieve. Today, we are looking at some sincere people again. I'll judge based on your pictures and maybe short videos, but not long videos, as to whether you have you scored for that. So the next exercise is, I just showed you what I was referring to. The serrations here, it's once again shown. You can see there are various sizes. So what can you blow up the, yes, can you blow up the slide that is, yes, thank you. If you could kindly just pay attention to that, I'll really appreciate it. I know you've done a great job, but we need to complete it. So this is the 15 number. This is probably the 20 number, although it's got all, it's a very old personal handle. So sometimes they don't hold on to it. Now you can see clearly there are serrations, and also there is a slot where the blade would settle, right? The blade, it'll sit. So that's where the grip would be. And that's a very useful thing to remember. Grip, and that's a slot. Now the next exercise is loading the blade onto the scalpel, onto the handle, right? Now remember, earlier days, there was the pack used to be quite different. I mean, you would palpate for which end is sharp because you don't want the sharp to come towards you. But these days it opens only on one side, which is a good idea. You open it up and you see that the rear end is presenting. And now this step is very important. Don't try to hold it with your hand, which is what you'll do. I know you'll be short of instruments, but please try to use instruments to pull it out. Right? It'll help you do. And remember, we've got a disposal box here where we are throwing it. There are lots of limitations of doing these skills in a scenario that we are in, but we'll do our best. Never give up. That should be the motto in life. Now, what do? I'm doing some jugglery. Can you see that? But that's just to demonstrate to you. The sharp end should be away, and we should hold it firmly right across so that I can slide it in and it'll settle with a click. Can you see that? It goes into the slot, hopefully. They're all old ones, so they be. Or it's too new for comfort. Now, never mind, you know that. Now the slot is fixed and it sits in with a sound, that click. And the other part is, please bear with me, this is a different size here. But remember, we will be able to slide it in. I'll show you in a 20 number blade also. Important thing here to understand is use the matching blade, and now I'm insisting on doing it on the same. You can see there's an issue with the groove here. So what do? We slide it in still. There you go. Never give up. Now that's the 15 number blade. Now you can see that this is the side of holding it, and that's the straight of the body of the blade, and that's the belly of the blade, and that's the tip. And I often ask this question, you can type it in the answer box, which is the sharpest part of the blade. That is the belly of the knife or the scalpel. So what do we do when we are making an incision? We just paint this belly rather than the tip. And how do I hold this scalpel? It'll be important. This is the classical grip, and in the meanwhile, I'll also complete the removal. What do we do to take this out of the equation? You hold on to the rear end, give it a gentle thrust forward. Don't take it out. Take it close to some kidney tray or any sharp disposal box and let it fly. Otherwise, it is all over the place. And you know what do you call that? IFO, identified flying object. So you are thrown out of the OT the moment that happens. So make it a point to use it very carefully, but importantly, learn to dispose of. That's the part 1 of your exercise, and it sits in with a click, as you can see. Right? Now, my grip is classically to paint the belly onto the skin. So what do I do? My index finger sits on it, and I paint the belly from one end to the other. And remember, the knife or the scalpel cuts from a point to your left to a point to your right, or a point away from you to a point towards you. Left to right, away to close. And scissors is just the opposite, easy to remember. Now I'll try and see if the other number also fits in, and that will actually help us revise the, that's number 20. You can read it. That's number 20. I hope the light is good. And not disconnect here. Now this is the next handle and the blade, as I was trying to show you. There you go. So hopefully this will fit in nicely. The idea is to teach you. This is the 20 number. You can read 20 here nicely. That's visible. Yeah, that's it. That's it. Now, again, I'll open up the wrapper. It's a bigger blade, which is used for mostly the incisions that you make the abdomen or any tough structure like skin, etc. And I got it out. Wrapper is away. Forceps back in business. Same old jugglery. I want to be in perfect position to load it and go right across. Another mistake that happens is when you hold it here. It is dangling. Don't be steady. Never have the sharp end towards you because you'll crush the sharp end, which is the wrong thing to do. Keep it away and hold it. Now you have the two should align, which is not a rocket science. Hopefully it should work. It did. And that's number 20, which is commonly used. So I'm going to use the palm grip and a pen grip or a paintbrush grip. What is a palm grip? It's classically visible. I'll just show it to you. I'll hold between the middle finger and the thumb, and it disappears in my palm along my lifeline. The index finger goes right on top. And what do I do to make an incision? I just now taught you that it is left to right or from a point away from you to a point towards you. I'll spread the skin. This is point A, this is point B. From left to right or from far to near. That's scalpel. Scissors is just the opposite. So I'll spread the skin apart with my index finger and the thumb. I'll put the belly of the blade on the skin, and as I advance, the fingers keep advancing to keep the skin stretched. And remember the follow through. As I reach the other side, I do a little bit of palmar flexion to make sure that the incision doesn't tail off. Other the incision would tail off, which is not a good thing. It should be the same depth throughout, but it should not be a funnel. Very often you make a big incision in the skin, then smaller in the muscle, finally very, very tiny in the area. So you make a big incision for a limited access, while we should be clever enough to make a smaller incision for a bigger access. I'll cover the instruments, then you'll get down to making an incision. So don't start making it. I have a request. Now, if you focus on what is being taught, don't use your hands to hold it and use any instrument to load it. Most of the time, the nurse will load it for you. But if you don't know your job, even the nurse will take you for a ride. Now, I keep it in the kidney tray. We are not keeping a sharp disposal box here, which you must have to demonstrate. I'll try and show it to you later on. Now, we made it. You should be here, but okay. We are trying to fix the light so that you're able to see better. It'll be very, very fine exercise. So please bear with us and don't be fussy, especially in a scenario like this. We are trying to do our best. Believe you me, it's tough, but we keep doing it. All right, so now we made an incision. The next instrument, since I mentioned to you about the scalpel, and I mentioned the scalpel, the knife cuts from left to right and point away to close, and scissors is just the opposite. So we have the incision made, and we can use now, I can talk to you about the scissors. Scissors cuts from a point to your right to a point to your left, and I'm repeating it from close to far. So don't remember the names if you're asked in the exam, just say straight and curved scissors. No big deal about it. You know, straight and curved. What is the significance of a scissors? You all know that. There are rings at the back, but there are no locks and no ratchets. There can be a screw joint or a box joint, which you can see here if you can zoom. Right? And then there can be the blades, which can be straight or curved. This is curved. This is straight and stouter. Actually, if you're very fussy about names, this is Metzenbaum scissors, and that's Mayo scissors, which is, but don't bother about it. These scissors are now made in the routine, market. So they are no longer the names that you would be fussy about. For those who cannot see it very clearly, I'm sorry. I'm trying to arrange it as much as I can. Switch off the webcam. So straight and curved scissors. Basically, you should know that the surgical scissors are better than the tailor scissors or the scissors of a barber. And how do you differentiate them from the ordinary scissors? It's the fulcrum. The closer to the fulcrum is towards the tip, finer is the cut. So if I have to make the scissors even better, I'll take the fulcrum further up, and something that you can see in the scissors. It's for suture cutting. We also have pot scissors, which are similar to this, but they're different here. Now this has got so much of steel is being wasted. You can say ridiculous waste of steel, and the fulcrum is close to the tip, and you can see that lower end is straight, the upper end is curved, so it can hook and cut. That's what you look at. And then there are rings at the back. There are no locks. But remember, this is used for cutting sutures. So it's one scissor that you will see. But basically the difference is in the fulcrum. In the tailor scissor, the fulcrum is in the center, while in a surgical scissors, it's towards the tip, right? Then why have the curvature. Remember that. Please note it down. You got a notebook. It was already instructed that you keep one. The differences should be clear to you. And the first difference is that the tip, the fulcrum is towards the tip, more towards the tip. And the second is, it is usually lightweight. So that's one thing you must remember. It can be straight or curved, because the one-liner that I teach my students is, in surgery, the basic principle that you should stick to is cut what you see and see what you cut. And that is only possible if you can see the tip. So therefore, if you're using the scissors, the tip should be looking at you or looking up. If the tip is looking away and you're trying to make a cut, say from right to left, you can see that I'll have to adjust myself to keep it straight. But if the tip is looking towards me, I'll just have to keep the tip straight on, and I can cut like this. I can go, I can go, I can go, I can go, I can go. But if the tip was that way, I'll have to keep adjusting each time. That is why the curvature. The second reason why you have a curvature is because if you're going into the depth and cavities, it can take the curvature, and yet the tip would be visible. So the tip should be looking at you is the basic principle. Remember that. So see what you cut what you see. Tie what you cut, tie what you see, and see what you tie. These two principles you must remember. So these two principles having been given, we'll move on to the next step. That is the use of scissors, which we'll do today. Now, the other advantage of a curvature is that if you want to raise a flap, you can use a scissors to raise a flap too. And how do I do that? See, even here, we can actually know that this is already a suture wound from last time. So I'll just demonstrate as to how do we do it. We've got an incision here. Don't use the tip down approach. What do? I'll hold the flap. The tip looks up again, right? And I'll extend my incision. I'll go extending. And I can raise a flap comfortably. The sharp end cuts, see the sharp end, the tip above cuts, and the tip below can actually dissect. You can use it in various ways. But remember, if you have to compare scissors with